Should you adjust your levothyroxine dose? Have you ever wondered if you should adjust your levothyroxine dose? This is a common question among those managing hypothyroidism. Adjusting your levothyroxine dose can be necessary, but it should always be based on regular monitoring of thyroid function tests, especially thyroid-stimulating hormone levels, and your individual symptoms. Factors like age, weight, cardiovascular health, and pregnancy status also play a crucial role in determining the right dose for you. The ultimate aim is to achieve a euthyroid state, which means having normal thyroid hormone levels and effectively managing symptoms. When starting treatment, most adults with hypothyroidism typically begin with a full replacement dose of about 1.6 micrograms per kilogram of body weight per day. Adjustments to this dose are usually made in small increments, typically between 12.5 and 25 micrograms, every 4 to 6 weeks. This allows enough time for thyroid-stimulating hormone levels to stabilize and for you to notice any changes in symptoms. For elderly patients or those with heart conditions, initial doses are often lower, around 12.5 to 25 micrograms daily, and increases are made more cautiously every 6 to 8 weeks to minimize the risk of side effects like increased heart rate. Monitoring is key when it comes to adjusting your dose. Thyroid-stimulating hormone is the primary test used to guide these decisions. If your thyroid-stimulating hormone is elevated, it usually means your dose needs to be increased. Conversely, if your thyroid-stimulating hormone is very low, it may indicate overtreatment, and a dose reduction would be necessary. Clinical symptoms also play a significant role. Symptoms of hypothyroidism include fatigue and weight gain, while symptoms of hyperthyroidism can include palpitations and nervousness. It's important to remember that dose adjustments should be individualized. For example, pregnant women often requiring a dose increase of about 30% to support fetal development. Changes in weight, other illnesses, or medications that affect thyroid hormone metabolism can also necessitate adjustments. Consistency is crucial when taking levothyroxine. Switching between different brands or formulations can impact hormone levels due to slight differences in how the body absorbs them. It's generally recommended to take levothyroxine on an empty stomach, ideally 30 to 60 minutes before breakfast, to optimize absorption. However, not every change in thyroid-stimulating hormone levels requires an immediate adjustment. Typically, it is advised to wait 4 to 6 weeks between dose changes to allow thyroid-stimulating hormone levels to reflect the new dose accurately. If your thyroid-stimulating hormone is very low, a small reduction of 12.5 to 25 micrograms is usually recommended, followed by repeat testing in 6 to 8 weeks. In conclusion, adjusting your levothyroxine dose is a careful process that should be guided by laboratory tests and clinical evaluations. It is essential to maintain normal thyroid hormone levels and alleviate symptoms. Always consult with a healthcare professional experienced in managing thyroid disorders before making any changes to your medication. Self-adjustment can lead to risks of under- or overtreatment, so professional guidance is crucial for safe and effective management of your condition.